My name is Dr. Marty Kotler, and I thank you for attending this video on the No Surprise Law and the Good Faith Estimate Forms. The information in this webinar is for educational purposes, and it's not intended to be a substitute for your thorough clinical decision making. It's not intended to be a substitute for your billing protocols. It's not intended to be legal advice. Target Coding doesn't provide legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. For those of you that do not know anything about me, let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I'm a chiropractor, and I practiced for 16 years prior to starting my company, Target Coding. I'm a certified professional compliance officer, certified billing and coding specialist. My company's been helping thousands of chiropractors and their staff members for over 14 years. My area of expertise is in compliance as it relates to billing, coding, documentation, Medicare, HIPAA. I've written many training manuals. I work with hundreds of healthcare providers nationwide. My team and I, we write articles to the major publications you see coming across your desk, like Chiropractic Economics, Dynamic Chiropractic, the American Chiropractor. My team and I, we speak at a lot of the seminars, Parker seminars, Foot Leveler seminars, and at many state association events. And I consider myself kind of unique because most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this presentation how I combine both specialties to make sure you're doing things properly and you're complying with laws and rules, and you're getting reimbursed what you deserve. So we're going to be talking about the No Surprise Law and Good Faith Estimate forms. It all begins with your patient forms. This is a partial list of the forms that you may or may not need to be using these forms in your practice: basic health history form, HIPAA notice, office policy forms, consent to treat. This is our basic list, checklist of forms every chiropractic practice should be incorporating some, if not all of these. And then you'll see the one highlighted in blue there is the No Surprise Law and Good Faith Estimate form. So we're going to go over that. But yeah, just a simple health history form is important, a good quality HIPAA form. Make sure you have good information in there, like can we confirm your appointments by email? Can we leave a message on your answering device? Could we discuss your condition with any family members? We have an open therapy room. We make good faith attempts to keep our conversations at a low level, all that stuff. HIPAA forms are very important. It allows you to get paid for what services you provided. So it's a good form for your protection. These are informed consents, also important. These are forms that talk about the possible risks of complications from a chiropractic adjustment. So these are malpractice forms. Check with your malpractice insurance company on consent to treat. And here we go, the No Surprise Law and Good Faith Estimate form. This became effective on January 1st of 2022. This law became effective on January 1st of 2022. It provides protection for patients from getting a surprise bill in the mail. Now, this is not for every patient. This is specifically for your out-of-network patients, your self-pay patients, your patients that are uninsured, your cash patients, patients that have insurance but they don't want to use it. Or maybe they have insurance, but it doesn't cover your services. Or they have insurance, but it's an HMO and you're out of network. It all started, in my opinion, from hospitals. Patients would go to hospitals. The patient, let's say, needs surgery. Mr. Johnson needs surgery. His surgeon is in network. The hospital's in network. Mr. Johnson isn't told in advance that the hospital brings in out-of-network anesthesiologists to do the anesthesia during surgery. Well, 2, 3, 4 months after the surgery, Mr. Johnson gets a bill in the mail for $3,000 from the anesthesiology group. Surprise! Well, that's illegal now. You're not allowed to surprise patients. Out-of-network providers typically charge different rates. This may lead to higher costs for patients. If a health plan doesn't pay for the services rendered, out-of-network providers can no longer seek to recover the balance by surprise billing unless you provide them with certain information and a form that I'm going to show you. Now, this new law requires that you supply your self-pay uninsured patients with a good faith estimate form. You must let the patients know how much the service is going to cost prior to beginning care. Now, a lot of you may be doing this already. You have the patients during the report of findings, you have the patients sign off on a care plan. That's great. That's a portion of what needs to be in the good faith estimate form, but additional information needs to be there, not because of what I'm telling you, because of this new law right from the federal government. It's not for in-network patients. Medicare, Medicaid, you're following those rules. You're abiding by the standard rules, collecting copays, coinsurance deductibles. The good faith estimate form must be displayed for patients to see and review. The good faith estimate form must have the patient's name, NPI number. You'll see typical chiropractic care plan doesn't have the CPT codes. I'm going to show you an example in a minute, the diagnosis, certain disclaimers. The good faith estimate amount must be within $400 of the actual charges. Now, some of you may be saying, well, I'm in network, so this doesn't apply to me. Patients come in, I charge them my $40 copay, and that's it. I'm in network. It's simple. Well, if you're in network, but you provide other services like laser, which is cash, decompression, you're in network, but decompression is not covered by insurance. Home exercise kit, orthotics, back braces, so you must also include those in your good faith estimate form. During the financial report of findings, have the good faith estimate form ready to review and sign. So here we go. Step one, you see the form on the left. It says patient rights and protections against surprise medical bills. That page, that sheet, needs to be posted either on your website, in your waiting room. You may want to laminate it and put it on the coffee table in your waiting room. Maybe you have a television that loops information. You want to have that information. So that page one on the left is important to display. The page to the right, page two, that's the instruction forms letting the patient know about this no surprise law good faith estimate form. And here is the good faith estimate form on the left is page one, where it outlines the patient's name, their date of birth, the diagnosis, the CPT codes, the quantity, the expected cost. So this is let's say a typical cash patient. 20 chiropractic adjustments at $50 each, $1,000. 20 tractions at $25 each is $500, and this patient is going to get a back brace for $100 for a total of $1,600. Patients must read the disclaimers and the patient acknowledgement information and sign and date it. Now, this may pertain to, let's say, PI patients also. Let's say at the end of the case, there's still money that's left over. And the patient says, well, just bill my regular insurance. And you say to the patient, well, we're out of network with your regular insurance. And the patient goes, oh, you never told me, oh, this is a surprise, so something like that. Or let's say you have the patient prepay for 24 visits or 36 visits. And after 6 visits, the patient says, oh, I want my money back. Just bill my insurance. You go, wait a second, we're out of network with your plan. Oh, you never told us that, Dr. Cobb. You see how this could be an issue. So that's the forum. Just a few closing comments. We've been helping chiropractors for over 15 years. We offer many types of services and products. Most of our webinars and seminars are approved for CEUs. Some of the products we offer are our forms, all the forms that you're receiving from this webinar, the good faith estimate form and the no surprise law information is part of our chiropractic forms, logs, and templates package. So yes, the no surprise law is in there. Exam forms, admin forms, sample soap notes, fight back letters, letters of medical necessity for kinesiotaping, laser, decompression, back braces. Many doctors get denied when they do an adjustment in manual therapy or re-exam on the same day as an adjustment. So we have a whole bunch of fight back letters and appeal letters, ABN forms, HIPAA forms. background check forms. We throw in some bonus forms on acupuncture, physical therapy, and telehealth. I also have a book that I wrote on the best codes to improve reimbursement. Chapter 1, there are 3 sections or 3 chapters. Section 1 shows you how to pair your codes. Pair your CPT codes with your diagnosis codes to prevent denials and rejections. Pair your codes just like food and wine. That's the analogy I like to give. So I'm a coding sommelier, not a wine master. Code and your CPT codes and diagnosis codes should pair, link. That's section 1. Section 2, I provide you with the codes that pay for the most visits. I call those long-term treatment codes, and it's based on per anatomic region. And I give you the short-term diagnosis codes and the moderate-term diagnosis codes all laid out. You get some cheat sheets emailed to you. And section 3, I provide you with 25 of the most common chiropractic diagnosis codes and the clinical rationale, the ortho, neuro, chiro tests to support the diagnosis codes. Very important nowadays with Blue Cross Blue Shield reimbursement. And then I also throw in a bunch of bonus FAQs in the book. We also offer other items besides the book. We have a decompression, billing, and coding compliance program. We offer a nurse practitioner. About 25% of the chiropractors we work with have brought in nurse practitioners to do knee injections and trigger point injections. So we put together a program for that. Memberships. We have 4 levels of memberships. Every level of membership includes our unlimited webinars club. You may be interested in our memberships. We also offer compliance manuals on HIPAA, on billing and coding. CA boot camps, we run these every Thursday. They are live every Thursday and we record them just in case you miss one. We try to put together every possible job description a CA could have in these 4 modules. We also offer an accounts receivables program. Do you have accounts receivables? I'm talking about money owed to you by insurance companies that is over 120 days. And no one's going after that because your present billing company is too busy to go after the old stuff. Your CAs, your in-house billing CAs are too busy to go after the old stuff. Give it to us. If we don't collect anything, there's no charge. We charge a percentage of collections. Run a report and email it to us. Anything over 120 days, outsource it to us. Would you like to get in network? Do you have a new chiropractic associate coming on board? You want to get him or her into Aetna, Cigna, Blue Cross Blue Shield, Medicare? We do credentialing. Not too many companies do credentialing. We can get you a Medicare PTAN number. Would you like to become an authorized DME supplier so Medicare Part B can pay you for knee and back braces? Interested? I'd say only about 15 to 20% of the chiropractors we work with do this, but boy, is it profitable. Most of our webinars and seminars are approved for CEUs. Please check with all the carriers you bill prior to submitting claims based on this information. Target coding does not guarantee the information will provide or guarantee payment from any patient or insurance company. And we're not responsible for any laws or rules they may change following this presentation. You know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars, webinars, and joining your national and state professional associations. Feel free to stay in touch with us. Check us out. Follow us on Facebook, Instagram. Go to YouTube. I have over 100 free videos on YouTube. I want to thank everybody for attending. Here's our contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Free for you to scan that QR code to set up a free consultation. Again, thank you for listening to this. I hope you learned a lot. Take care, everyone. Bye-bye.